folks, much more still ahead, as many parents, as we were just saying, are left wondering how they can talk to their own children about what happened in Connecticut on Friday. We'll be talking to a psychiatrist who will walk us through the steps to help talk about it with your children. We'll be right back.
Well, we can't begin to imagine what the parents in Newtown are going through this weekend. This tragedy has affected people throughout the world. Now, many parents are left wondering how they can talk to their own children about what happened Friday. Valley psychiatrist Dr. Michael Yasinski is here trying to make sense of this all. And, you know, you really can't make sense of it, can you?
Really, there is no sense to be made. I think we can try and label or figure out what someone's diagnosis was or what happened, but I think it might be worth taking a look at some practical things about maybe what we can do to prevent this from going forward and take this time to actually talk to our children about, you know, things like mental illness and things like too much video games that really take the humanity out of people, allowing people to perform these mass murders. We almost don't see them as human anymore. And it would be a time to kind of talk to our kids about maybe some ways we can prevent things rather than focus too much on simply the violence and tragedy aspect of it.
So several days have gone by. Obviously, this has been splashed all over TV. What do you tell your kids to make them, I don't know that they feel secure, but at least you kind of calm them a little bit?
Yeah, I think giving them as much information as possible in an honest way. I don't think sheltering them, at least with the facts. You don't want to necessarily expose them to the violence on TV constantly. But I think being honest with them, and I think really letting them express emotion, you know, encouraging them to express the fear, emotion, sadness, and then simply encouraging them that this is really a really rare thing to occur, you know.
What age is too young to, you know, they say you shouldn't tell kids too much.
Right.
Where's the cutoff as far as ages on you know, how to go into an in-depth explanation of what happened?
Yeah, I think kids are actually smarter and more savvy than a lot of people think. And the problem is if you don't talk to a child, you never know what they're going to hear in school and with their friends and what other parents have told their kids. So it's better to have the information come firsthand in an honest, relaxed conversation with your child. Even as young as 5 or 6, if they're going to go hear it from people or hear rumors from other people, why not have that conversation? Builds maturity, and you're able to feed them the information that you want to, rather than, you know, someone else's parents or children that give them wrong information.
For some of the school districts out there, should they address this, say, tomorrow morning to many of their students?
Yeah, I think addressing this is key. What I'd like to see them do is actually, you know, some more teaching on mental illness, for example. I think we get caught up in, you know, trying to figure this out, but there's just a general lack of understanding. There's a lack of kids, like in this case, probably suffering from many years of internal anger, and there's no channels. Kids are embarrassed to talk about that. So I'd like to see them bolster their programs to get kids actually wanting to seek help, because we can have as much help available as we want, but if kids are not open and wanting to go seek that help, I think we need to bolster the kind of acceptance of mental illness. That's what I'd challenge schools to do. Let
me ask you this, because you're hearing family members come out and say that Adam Lanza had some issues there. He was kind of a recluse. He was to himself a lot. If somebody sees a child out there like this, child, teenager, young adult, what can you do?
Yeah, I think unfortunately that same pattern continues to repeat, the isolation and the internal anger and the long-standing anger. I think, you know, all we can do right now is getting them help, pointing them in the right direction, getting them to see a counselor, a therapist, but really it's motivating them to want to get help. We can't pick and choose who needs to get help all the time. Obviously, it's always too late because we look back in retrospect. So really going forward is bolstering their acceptance of psychiatry and them actually going to seek help.
All right. Thank you very much for your input here.
Thanks.
I'm sure we're going to be talking about this for weeks and months to come. Thank you.